everyone, and welcome to the Resilient Vet Podcast, where our mission is to help you create more resilience in yourself and your team by up-leveling your physical, emotional, and mental health. Today, we are going to be talking about nutrition on the run, such an important topic. I'm Dr. Jennifer Edwards, a leadership and executive coach and a veterinarian, and a former practice owner, and I am the founder of the Core Element Leadership Framework. I work with leaders on the internal part of leadership, the stress, the overwhelm, the feeling alone, and like it's so hard to create what you want. I help strengthen clarity, decision-making, communication, and culture, so you can perform at a high level without sacrificing well-being. Today, my co-host Aaron Shaw is going to take the lead on this important episode.
Thank you for the intro. My name is Aaron Shaw, and I am I'm a health nut. So I'm just going to put that out in the open to start with. I am an occupational therapist and strength and conditioning specialist, and I've been in practice since 1996. So it's been a couple of years, and I love all things health, wellness, and that includes nutrition. And I happen to be married to a veterinarian. So over the past many years, I've gotten in very close with the vet community and have founded what I call Project VetSpan, which is a service to help individuals and teams, vet professionals and vet teams be healthier and extend their career, what I call VetSpan. It's like lifespan and health span. And it turns out that if I were to go into a break room of a typical veterinary clinic or practice, there is a little bit of room for improvement for nutrition for the staff, a wee bit of an opportunity to be a little bit better. And so what I want to do today, trying to be very practical, is talk a little bit about how you can leverage nutrition, what you eat, how you fuel yourself, to have a longer career and ultimately better outcomes, better clinical outcomes, and just feel better. So I'm going to give you 3 specific reasons why nutrition is important to your career. And I'm going to follow this up with 3 very specific systems that can make really giving you quality food on the run in a busy clinic your default, to make it easy. So that's one thing to sit here. We're not going to dive deep into be too idealistic. So what I'm going to talk about today is going to be very practical. Practical in a busy clinic scene. So let's see if this sounds familiar. Have you ever, Jen, started your day maybe hustling into the clinic? Maybe things are kind of busy right from the get-go. First appointment, maybe it runs a little bit long. Maybe you've had a little bit less than you want to from a nutrition standpoint. Maybe you're feeling a little bit hungry, and you happen to just run in the break room, or maybe you're lucky enough to have a vendor or a client bring in some donuts or some treats, and you kind of eat that, which tastes so amazingly good. To be clear, no matter what I say from here forward, I'm not against donuts. I'm just using them as an example. But you eat a donut and it feels pretty good for a little while, but then you realize a little bit later, you kind of have to pay the consequences of that. Have you ever had that sensation?
Yes and no.
You've never eaten a donut. Go ahead and say
I've
it.
eaten donuts.
Okay.
However, I tried my very hardest to keep that stuff out of my break room when I owned my practice. When I opened my practice, and of course all of the various vendors all came calling and knocking on my door, and I actually set a rule with all of them right from the beginning, and I said, don't bring us boxes of donuts. My practice was right across the street from a bakery, and they had these huge, like this big, huge cookies. And they were this like soft, gooey, and they had all these different flavors of cookies. And every now and then a vendor would bring us cookies, and I would say, we love the cookies, however, please don't bring us cookies on a regular basis, right? A treat is nice every now and then. Because what can happen is it can just start to become a habit. But yeah, of course. I mean, I'm human. I've had that situation, and you go in and you're like, whatever, and you grab it and you eat it, whether it's the donut or the cookie. And then honestly, usually I feel like garbage after. So, it's tempting, it's hard, but I think the best strategy is to just try as hard as possible to keep the stuff out of there. But that's hard to do. So that's what we're going to talk about today.
Absolutely.
So we all know that we can choose habits that make us healthier. And we also know that it's really hard. Now, whether to be healthy, whether to maintain optimal weight, to stay fit is a personal choice for each one of us. But when we're thinking about a veterinary clinic setting, Erin, why does all of this matter from a clinical perspective?
That's a great question. I think that it's really worth the exercise in framing food differently. And I think that as a culture, at least in the U.S., for a lot of us individually, we have sometimes unhealthy relationships with food. And so I think that I like to even use the word fueling and energy as opposed to straight up food, like good food or bad food per se. But I think that the way we fuel ourselves in a vet clinic setting has a huge impact on our physical performance and our cognitive performance. So I want to talk about three specific impacts that food has in the clinic setting. One is cognitive performance, one is client communication, and one is team dynamics. And part of this, team dynamics part is really being a reliable peer, which we all want to have around us, and we also want to be a reliable peer to others. So let me break these down briefly one at a time. So fueling or having energy for cognitive performance. What I think about with this is blood sugar spikes. We have all those sugary, tasty things. Perhaps this even starts at your local Starbucks, where your Starbucks drink sometimes looks like what used to get at Dairy Queen or something like that. It's already sugary to start with, and then maybe if you do have a sugary treat or a pastry with that, in the moment, what's happening is your blood sugar spikes. You'll get a little surge of energy, which feels great, but then inevitably there's a consequence to that, and so we'll have an insulin surge, and then there'll be a crash of what we'll call a crash or a dip in energy. And when this crash happens, we actually have this is a very obviously a physiological response to the carbohydrates, to the sugars. We'll have reduced attention, slower processing speed, more mental fatigue, and in the vet setting, it is you're constantly making micro decisions, thinking about, drug dosing, diagnostics, surgical precision, emotional stability, keeping an eye on everything around you at all times. And if you are crashing from the sugar buzz, your cognitive performance is going to be compromised. So if your glucose is going to be on a roller coaster, your attention will often also be on a roller coaster. And that is not an ideal setting for practicing vet med. Can you relate to that?
Yes, 100%. As you were talking, I kind of raised my hand there for a second. I was like, yes, because I can almost in my mind go back to moments sitting at the desk at the computer typing up notes or talking to clients when I was in that afternoon crash, whether it was because I ate something in the break room or, for me, it was more like the iced coffees with the sugar in it. And then, of course, you get that caffeine spike and the crash on top of it. And I almost in my mind's memory went back to this feeling of oh, I'm so tired. Just that heavy feeling like I had gravity boots on, that brain fog feeling, and you're on the phone with the client and they're asking you all these questions and they always have one more question and you're like, please stop.
Exactly.
And it's so funny, as you were talking, I just literally had this flashback because I think that is what so many of us experience. And then what do? We go get more sugar or more caffeine to counteract that. And then I just know that there were times I would just be on this vicious cycle of up, down, and for our medically trained people listening, that Samoji effect of when we see it in diabetics, well, that happens in non-diabetics as well. And it's just that our bodies can recover from it on its own is the only difference. So you mentioned earlier that on top of cognitive performance, this also impacts how we communicate. And I'm really curious to hear more about specifically how you see the connection between nutrition and communication.
100%. So I think you kind of led into it right there. That if I'm that patient on the phone and you're talking about if I'm calling in and asking you questions about my Portuguese water dog, my wild child with a mohawk, and I hear you yawning with your post iced coffee sugar crash happening, I'm gonna have to think, are you giving me your A game right now? Are you really going to be crystal clear in what is really important, like important in this conversation, in this communication with me? And I think that if it's without getting too deep into the science, it's pretty obvious. We all know, no matter what kind of diet you're on or what kind of nutrition you have, we all should be very well aware of this roller coaster of the sugar buzz and kind of that crash and that kind of that fog that happens. So it's not really fair to think that we're going to have excellent communication when we're on this roller coaster. So low energy leads to low patience. We have to have in vet medicine some very serious conversations, some very difficult conversations, some that's related to the diagnosis that you may have just discovered, or you may be communicating that with a pet parent and or the human beings that are in vet medicine that are dropping off their loved ones. They may come across, and they may also be on a sugar roller coaster themselves, and so it could really be the perfect storm of miscommunications, having difficulty with emotional regulation, not being able to communicate clearly, not because of a lack of intelligence or understanding on your topic, but you're fighting this. The physiology is fighting against you, basically. So as you're coming down off of this sugar buzz, again, we're all I don't want to say victims of this, but I mean we all have the consequence of things change cognitively when that happens, and everything is more challenging. Simply, staying awake on a phone call, we feel the weight of that, and it's not fair to expect to have excellent communication when you're on that roller coaster.
Yeah, absolutely. And I think sometimes there can also be subtle energetic and subconscious impacts as well that people may not even realize. Um, when we communicate with people, especially as leaders, but even just peer to peer, professional to client, we choose our words very specifically. We're very nuanced, and we all know how easy it is for an intention behind a communication to not land or be heard the way that it was intended. And when we are in a brain fog and we're tired and we're sluggish, our tone of voice can change, our nuance in our word selection or sentence structure can change. We can appear more monotone. And all of that subtly can have impacts on the way we are heard or interpreted, even if they don't say so in the moment, right? It's not like it might cause an argument, but somebody could walk away with an impression that is different than what you might have wanted or what you might have created if you had clarity.
Exactly, and that's where it leads into team dynamics as well, which is the third point. So, behind clinic doors when you're with your peers, if somebody is having difficulty communicating, or they're, again, they're more irritable, or their mood is, our moods will fluctuate with the sugar as well, with these highs and lows, and even kind of just take a step beyond the sugar itself, it's eating and not eating too. So it's not just the donut that'll give you that sugar buzz and the expected crash. It's also not eating enough, not timing your nutrition well to have a sustained energy, sustained clarity, sustained potential for quality communication. And when you're having clinical discussions with your peers, again, that's going to have a compromised effect to that. And not that you're going to make horrendous decisions per se, but you're missing the opportunity to be at your best, to really practice at your potential. And that's going to impact in the moment. It's going to impact the day. But if you can imagine that if this roller coaster of energy, because your fueling is all over the place and it's not really aligned with the demands of what you have to do in practice, it's hard to expect to have a fulfilling career for 20, 30 plus years if you're always in this mismatch. And so that's why fueling, nutrition, energy management, however we want to call it, is so important in practice.
So all of that makes perfect sense, and think the vast majority of people can relate in some way of having experienced that, right? Like in both eating the wrong things and in not eating, like the term hangry, right? We get grumpy, we get irritable, and we are not showing up as our best selves when nutrition is not adequate, regardless of if it's too much or too little. So I guess my question would then be, so what if I do eat that donut or that cookie from across the street, right? Like, we can't completely expect ourselves or anybody else, with the rare exception like you, to completely give up this stuff, right? And I know that I do like my Starbucks lattes every now and then, or we did have one client who always made these fresh homemade cookies that I could not resist, right? So tell me about how to find that correct balance of being human and being healthy.
So for the record, again, I will say that a good cookie is hard to pass up, and I'm not anti-dessert or anti-donut. But I think there's a time and place for everything, and it's in part it's being mindful and intentional, knowing and understanding that we're all bound by physiology. We don't have to like it. It's not fair, etc. It doesn't matter. Our body's going to have a physiological response to what we consume. So we're not looking for bodybuilder, Olympian, competitive athlete, with a dietitian, nutritionist, and a cook, at your side at all times, like making sure things are perfect. That's not what we're looking for. We're looking for good versus perfect. More often than not, making decisions that will be in the plus column, that will help us achieve our potential, that will help us be clear and feel good and have energy. If we do that more often, then we do things that we know have a consequence that sometimes drags us down, we're leaning in the right direction. And that is good enough. And I think for each person, we're all individuals, and a lot of my clients can kind of get away with, I don't hate to say even cheating, but they can play that game a little better than others. And some people are really sensitive. And if it's, the sugar or the lack of food or skipping a meal or even eating an hour later than normal, they feel real consequence to that. So everybody is unique, but I think with some reflection and learning what works for me and what works for you, trying to more often than not make thoughtful, intentional, good decisions, that's enough. That's good.
Okay. So very often there's a gap between an interesting piece of knowledge and actually having an implementation plan to make something actually real in our life, right? And so the gap is often how do I go from knowing something to actually living it? So if we have somebody listening to this right now and they're motivated, they want to make a change, they want to change the way their break room looks, how would they go about doing that?
This is one of my favorite topics. This is because it needs to be so practical. And when I talk to leaders who want, healthier teams and more resilient teams and more durable teams, want the resilient vet, there's many angles to go at it. But I think what for many can be so practical is nutrition in the break room. So we touched on some of the physiology. So there's a very real relationship between what we eat, how we perform. Individuals and as teams, we want high performance teams. The least we can do is fuel our teams for success. So the break room is the perfect place to start. And for leaders, I would encourage leaders to I'm not suggesting that leaders buy meals and feed their team all the time, but it may be a really good investment to have healthy options. So when the cookies do come or the donuts do come or whatever people tend to kind of bring into the clinic to snack on their own, it would be great if they had kind of this rocket fuel option with them that will help sustain their energy, because as a leader, it's going to benefit you. It's going to benefit the practice. It's going to benefit the patients. So I'll say that there are 3 systems that I'll talk about. System number 1 for the break room is a protein anchor. So protein gives more sustained energy, kind of prolongs energy. compared to a sugar buzz, compared to to carbohydrate. Carbohydrates are readily available. So specifically, I would consistently have one or two protein forward options available in the break room at all times. These include, but are not limited to, single serve Greek yogurt, super high in protein, great for you. Hard boiled eggs. If you are a little bit patient, you can hard boil the eggs and bring in a bunch. You could hard boil them and take the shell off. That would be extra credit. Or you can actually, I just discovered this about a week ago, you can buy little bags of hard boiled eggs at my local supermarket that are just ready to eat. How cool is that? So you can have hard boiled eggs, cottage cheese cups, protein shakes, something that's just ready to drink, individually wrapped cheese sticks. You can even have a clinic that really likes jerky. So they have a bunch of different types of beef jerky. These are protein forward. Everything I listed tends to be 15, 20, 25 grams or more grams of protein per serving, and it will reduce the risk of an energy crash. So you're putting good fuel into the system. It will help manage hunger, so you're less likely to be hangry, and far less likely to have that crash because you're putting in slow burning fuel. So having those items specifically in the break room are protein forward, and they're a great anchor.
And to add just one comment to that, I know that when we add, and I think you mentioned you're going to talk about this, but like when we add protein, even if you eat that half a donut, if you put protein with it, it actually stabilizes the blood sugar. Because I know with people with type 1 diabetes, they will often say, if you're going to have something sugary, eat some cheese or eat a source of protein with it to help prevent those spikes and crashes.
100%. So that brings us to the second point, which is having a stabilizing combination snack. So here are some examples where we would want to pair carbohydrates with protein or carbs and fat, but something to take that carbohydrate and slow the burn. We want that energy to come gradually and not just like as one big spurt up and then you're done. So choices for this could be apples and peanut butter, bananas and a handful of almonds, whole grain crackers and cheese, berries and Greek yogurt, and as you said, like if you're normally somebody who wants to grab and eat half a donut, that's your go-to, and you can't imagine not eating that half a donut, it's okay. It's fine. Take that serving size of donut that you would otherwise normally have, or muffin or whatever. Take the serving size you would normally have, cut it in half, and fulfill the other half of food with a scoop or two of cottage cheese or something that's protein forward. So as your body's consuming this energy, maybe one or two bites are going to be primarily carbohydrates and just simple sugars, but another bite's going to be primarily proteins or fibers, and as a net total will be far less of that roller coaster that we were talking about earlier. So combining things is really important. And again, all those things I listed, what's most important is their availability. They need to be in the break room or at your desk or in your pocket or something. It has to be practical to use.
Yeah. If things are not easy, nobody's going to do it, especially in veterinary medicine where we're often on the fly, running crazy, clients are waiting. The quote lunch break is really when you're, treating your hospitalized patient or, dealing with the wound on the dog. One of the things you mentioned was portion control. And I think that is really important because we don't have to completely deprive ourselves. We can still eat something and enjoy it if we do so in smaller amounts and slowly. So one of the things that I used to do, if the donuts were there and I really wanted them, or one of those famous cookies, is I would take a knife and I would cut off a little piece, like not even half of the donut, not even a quarter of the donut. I would cut off like a 1.5 inch little wedge. And then what I would do is I would take that little piece and I would break off tiny pieces and I would eat them. And then I would eat the next one. So I was actually eating like 10 or 15 actually bites. They were just little bites. But if you pause and taste it, the taste and the experience was no different than if I had taken full on bites and scarfed down a whole donut. So when you bring some intentionality and a commitment, right? Like people might say, oh, well, that's easy to say. Well, at some level, all of this takes a level of desire and commitment, right? That's a it's all choice. But if you want to make the choice, but saying completely no is hard, then those are some strategies you can do to almost like trick yourself. You know, it's like the dog when you're trying to tell the client the dog's overweight. Just give them little tiny pieces of milk bones. Like the dog has no idea how big they are. Well, we can trick ourselves the same way.
100%. And there's great science that shows that how that will help us reach a point of being satisfied sooner, because and again, as another aside for another deeper conversation, is even our sense of being full is delayed. The communication from our gut to our brain that says, hey, that's enough, is delayed. So ultimately, even if people just generally ate a little bit slower, smaller bites, you would find that actually you'll get that message of being fuller in a more accurate time frame. Other than when we've all, Thanksgiving aside, we've all had this experience where we sit there and think, man, I would have been perfectly happy 2 bites ago, but it's too late now because I just had those last 2 bites, and now I'm a little, not on a little bit. It feels like too much, right? And so the solution to that, above all else, is just slow down a little bit. Slow down, smaller bites, chew more. The more the first part of digestion happens in our mouth, right? So you chew it a little bit more, you're going to get more of the nutrients. You're going to be more satisfied with it. 100%.
So without having to have a whole lot of refrigerated items that may be hard to always keep on hand, or they go bad, I've heard you mention this idea of an emergency drawer. So tell me more about that. Like if I wanted to create an emergency drawer, and just a reminder, you don't need the entire break room to change. If you're an individual and you're not in charge of the break room, you can still do this for yourself. So if I wanted to create an emergency drawer for me, what would that look like?
Great question. So emergency drawers. So drawers are not just for junk. I think I have a junk drawer like everybody else, but you can have an emergency drawer. And what I would put in this, again, it would be like non-perishable food items that you could literally stock up, hit Costco, whatever you want. And if there was always something in there, it would be give people the option for their little bit smaller slice of the cookie and something else. The something else would be mini small bags of mixed nuts. You can get individual packets of nut butters, like almond butter or peanut butter. Protein bars. So the key with protein bars, you're going to want to look for ones that have low sugar and really give you at least 10, closer to 20 grams of protein. And there's so many different protein bars and supplements and stuff like that. And I get asked often, like, which is the best one? It's so hard. Everybody has a different palate. I would encourage people to, next time you're in the store shopping for these, grab a bunch and flip it over and look at the nutritional value. Because a lot of them are ultimately basically Snickers bars with the word protein on the package. So kind of compare and contrast, see what fits your palate, but try to get something that's, again, 10, 15, ideally closer to 20 grams of protein in it. Again, non-perishable. It's in the emergency drawer. It's there. Eat a bite or two. Set it down at your desk. Go back or put it in your pocket and eat it later. Tuna packets, roasted chickpeas, and even it's okay to put little nibs of dark chocolate in there too. It is. Yep. It is. It is.
He said it.
I said it. Yep. So I would much rather if people had little. Like how sometimes, once in a while I'll go to a nice restaurant and they'll give you like a little chocolate thing at the very end. And it's not a. And certainly, I admit I had a slice of cheesecake after dinner one night this past week. Paid the consequences because I didn't sleep very well. But a good piece of little chocolate, just a little bite, as you were talking about, like the little bite of donuts. If it's when those things are so small, first of all, I'm thinking this thing better be good because it's I could chew this and be swallowed in 2 bites, and a good piece of chocolate is something to be savored, and that's fine too. So if you can have a handful of nuts or something that's gonna be stable in a drawer, throw a few dark chocolate pieces in there too. That's fine. It's okay. Permission granted.
Thank you.
Yeah.
Yeah, so Erin, this is all just such useful information. And so what I'm hearing from you is basically saying, good is good enough. You don't have to be perfect. General advice: staying away from the high sugar pastries, being conscious of how many calories you're drinking. The lattes are yummy with the whipped cream and the caramel sauce, but be aware of the calories and the sugar involved. The energy drinks that people use to, you know, you mentioned it, but we didn't go into that a lot. But like they use it as a meal replacer. Energy drinks are not a meal replacer, and it just worsens the crash. And I think an important one too is that whole idea of skipping meals, right? Because that was actually for me the harder part. It was easier for me to not eat the cookies and the donuts and just not eat. And so this idea of an emergency drawer for me is so powerful, because there are a lot of people like me out there who will just not eat because I don't want to eat the junk, and there's just nothing healthy to eat. And understanding that not eating is just as detrimental to your health. So having good, healthy options at hand so that you can grab and go in the crazy veterinary clinic. So just real quick, what could somebody just start doing now, this week, if they wanted today to make a shift?
Good question. I think that the first step one is being humble and realize that it takes time to change. And if you have listened this far, that means you're obviously curious about change, about nutrition, about energy, about your career, about making good clinical decisions, about being a good teammate. But the challenge for, let's say, week one would be to think about adding protein to your first meal of the day. So that would be a good place to start. Let's start by putting fuel in the system that's going to give you kind of a slow, steady burn versus a quick spike, which may give you a little buzz like, hey, I feel really good today. But if it's, if that's from 99% carbohydrate, there's going to be a 99% crash coming down the pike. So for this week, maybe think more about protein first. Maybe pair every carbohydrate snack you have with protein or with even fat. So again, that goes back to an apple and nut butter, banana and some almonds, like something that can kind of give you maybe a little bit of sweet and savory mix. Again, everybody's palate's going to be a little bit different, but start there. And this week, again, I'll give you one more thing you can think about doing for this week. Build an emergency drawer. Build an emergency drawer for yourself, or maybe some colleagues at work. So if there are 2 or 3 of you at work that are all on board with something like this, go in and say, hey, let's have some other options. And again, to go back to good versus perfect, when Mrs. Smith brings in her fresh home-baked cookies that are so amazing, by all means, have a little bite. That's okay. But that should not be the anchor for your nutrition.
Okay. Thank you so much. It is so helpful and useful to have these tidbits of like how to take the I know I should be healthy to actual implementation in a clinic setting. So Erin, if people wanted to learn more about you or connect with you, where would they go to do that?
I would go to projectvetspan.com. That is my main site where I connect with individuals and teams to help them learn about things such as nutrition and exercise and overall ergonomics and biomechanics to help extend careers for vets and their teams. That'd be the best place. And you can also find me on LinkedIn, fairly active there. So check me out there. What about you?
Well, first of all, I would just like to tell everyone, if this episode resonated with you, please feel free to share with your friends and colleagues so that everybody can learn how to be more resilient in this profession. Because conversations like this are how it really starts. But to learn more about me, my coaching, leadership programs, speaking, you can check out my website, drjenniferedwards.com. That's doctor with a DR. Connect with me on LinkedIn or any other social platform. It's at Dr. Jennifer Edwards. And I would just love to hear what landed for you inside of this conversation.
Thank you so much for listening, and here's to your health. Here's to your resilient vet career.